Okay, hi everyone. So my name is Irina and welcome to our June edition of Research Reels. So as always, before we get started, let me introduce to you this series and who we have as our speaker today. So who is IMPART? IMPART is a national research team headquartered at Dalhousie Medicine, New Brunswick. And although we are headquartered there, we encompass 45 academic and clinical partners across 8 universities all across Canada. So we're a pretty wide network of universities. What is Research Reels? So Research Reels is a monthly seminar series that we created to improve networking amongst researchers across Canada, internationally even, and especially amongst IMPART members. So hopefully this will enhance opportunities for future collaborations and support knowledge translation of research findings, as these webinars are also widely accessible on our social media and YouTube channels. In addition, if you know someone who'd be great for an upcoming Research Reels, stay tuned to our post-webinar survey where you can nominate a future speaker. And actually, some of the speakers we've currently had are nominated. So that's an exciting opportunity. So IMPART is also present on all these different social media channels. As you can see, we're pretty much wide across the board. And a new one that we'll actually have to drop in here for the next webinar is our new TikTok platform, where some of our graduate students are really trying to bridge the bounds between researchers and the public and community. So like I mentioned here, take a screenshot, follow us if you like. We are also uploading these webinars onto our YouTube channel. So here are some of the previous ones that we've completed, and we usually upload them 1 to 2 days after the webinar. So you can find these sessions there as well. So without further ado, let me introduce to you our current speaker for today. So today's speaker is Dr. Stephan Dombrowski, a health psychologist interested in behavior change. He has led the Behaviour Change Lab since 2018 in the Faculty of Kinesiology at the University of New Brunswick. And the work of the Behaviour Change Lab focuses on the development, testing, and application of behavior change theory and intervention for health and wellness. Dr. Dombrowski's research covers a range of health behaviors in populations and uses qualitative, quantitative, and mixed methodologies. I will now pass over the floor to the speaker himself, who will give a bit more insight into this research. And here's his information and Twitter if you'd like to follow. I think the lab also has a personal Twitter account if you're interested. Okay, Dr. Dombrowski, feel free to share your screen now.
All right, thank you for the lovely introduction. Can you hear me?
Yes.
Perfect. All right. And thanks very much for the invitation to give this presentation today. I'm very delighted to be here and to talk about behavior change. And the title of this talk is Understanding and Changing Health Behavior. And sort of when we discuss sort of what the focus of this talk should be, I think I offered talking about sort of one concrete research study in and of itself, a little bit like this mountain, just talking about a mountain like that, or giving a little bit of an overview and sort of a bird's eye perspective on the field of behavior change. And I think the preference was for the latter. So I won't be talking about just one project, but I'll be giving a little bit of an overview of behavior change and some of the theories, models, and strategies, and then talk a little bit about some of the research that we do in our lab. We do have a web page. There's apples seemingly indicating health and behavior. So that's our standard symbol there. It's full of apples, and we've got squidgy brains as well, which is great. The lab's been existing since 2018, since we came over here to New Brunswick. So we're a relatively young lab in the Faculty of Kinesiology, but we've got t-shirts. So that's got to be a good thing. So the overall aim of all the work that we do in the lab, my students and I, is to try and understand behavior with a view to changing it. And I thought I'd start off with a wee quiz before we get started. So in your head, you give yourself a point if you don't smoke, if you drink in moderation, alcohol, that is, if you eat 5 portions of fruit and veg a day, and if you are physically active. Yeah? So in your head, you should have a score between 0 and 4 now. And if your score is 4 compared to 0, then congratulations, you've just added 14 years to your life compared to a score of 0. So this is data based on one study that followed up over 20,000 middle-aged healthy adults over 11 years on average, and they discovered that the more health behaviors people performed, the less likely they were to die, right? So a very hard health outcome. And the more behaviors you performed out of these, the less likely you were to die. So the summary of studies like this, and there's a variety of different studies, it's not a UK specific phenomenon. There's data in Canada, North America, and a variety of other countries to back this up, is that behavior matters. So what we do matters for our health and for our wellness. And if we look at data in Canada and we take the same 4 behaviors, we see, and we score people here, we can see that the majority of Canadians, according to the survey here in 2016, do not perform 4 of the behaviors. More women than men perform them, but the vast majority score 2 or 3. Yeah? So there is room for improvement. Most people do not do all the things that we know are beneficial for their health and wellness. Okay, so here I'm a psychologist, right? So I like boxes and arrows. So I've invented the theory of health behavior. So that's obviously an amazing model. You've not been aware of this kind of knowledge, right? So it's been worth tuning in just for that one, right? But the key point is, obviously, you know that what we do matters for our health. Yeah, our behavior is vitally important. And seemingly boring things, mundane, everyday behaviors can add up and have a massive impact on our health and wellness. So the key question then, which is sort of a question that we grapple with in the lab, is why don't people do all the things that we know are good for their health, right? And that might be because there's a variety of things that sort of get in the way to them doing it. And a question then is sort of, what might be these factors? What might be the barriers that get in the way of explaining this phenomenon that we call behavior, right? And that we as psychologists are interested in. And oftentimes when you talk to people and say, okay, what sort of gets in the way? So, okay, knowledge. People are not aware of all the things that are good for their health. And, you know, I've just shown you this survey on the more of these big 4 that behaviors that you perform, the better it is for your health. So now you have the knowledge, and now you translate that into doing all these things, right? But there's a variety of other things in addition to knowledge. So social identity, for example, so is a behavior sort of in line with how you see yourself, with your own perception of yourself and your identity, and how you see your social role. Do you think you're capable and able to do something? So your confidence in your ability to do something. Our environment and resources. So both the built environment and physical and psychological resources are very important, and there can be barriers. Behavior regulation, so the degree to which you have thought through and planned what you're going to do, when, where, and how, and monitored your goals and whether or not you're achieving them. Emotion can be a big barrier, so fear, anxiety, shame, disgust, these are all potential barriers that get in the way of us doing something. Social influences, so what other people around us do, is very much important and influences what we do. Our memory, attention, and decision processes, so, you know, sometimes we forget or we miss opportunities to be able to act, or haven't made up our minds what we got to do. So they can get in the way. Motivation goals, sometimes we just might not feel like wanting to do something. Beliefs about consequences, so we might not have a positive attitude towards something. We might not really think that something is good, or there might be other costs that we want to avoid, so we don't perform the behavior for that reason, or we just might not have the skills to do it. An example is cooking, right? So all these different healthy meals that you could cook, but if you think you don't have the skills to be able to do that, or you actually don't have the skills and you would need to acquire them, then that could be a barrier. So you can see that there's a variety of different things that can get in the way to people doing something, even though we know that there's evidence that if they did this, it would improve the likelihood of them being healthier in the future. So the answer then to the question is, why don't people do the actions that are good for their health? Is because there are a lot of factors that can influence our behavior and that can get in the way. Okay, so if we go back to our theory of health behavior and we squish that down a wee bit, and then we have all these different factors, right? So these are just factors that I haven't really elaborated on how they interconnect, and there's a lot of theories out there that would elaborate on the interconnection of these factors, but all these factors are relevant to some degree or another, depending on different populations, different people, and so on. But these are all factors that have been found to be related to people performing or not performing certain behaviors. And oftentimes when it comes to behavior and behavior change, there's sort of a complexity reduction that takes place where people sort of are semi-aware of all these different factors. But when you ask, sort of, why do people not do something? It's knowledge that always comes out on top. It's like people, you need to educate people, you need to tell them that this is important, and then they will do it. Sort of this simplistic, intuitive model of explaining behavior. So it's a lack of knowledge, and we need to educate people. And if that was true, that would be nice. I'd probably be out of my job, but it's doesn't. There's not much data to back that up. That particular simplistic model of behavior. So here is a card that a colleague of mine sent me over a decade ago now. So obesity can shorten your life by 13 years. And this guy thinks here, go large or live to see the grandchildren. So it's not the way that this kind of knowledge and education influences so behavior, particularly in certain moments. And I think this sort of simplistic conceptualization of behavior is reflected in many things that we come across in our daily lives. So here's an article, not a bad article or anything, but just an example of a simplified notion of behavior, where they wanted to highlight that our diet and our eating behavior is related to climate change, and we can change our eating behavior and therefore increase our environmental wellness overall. So here's something from the article saying that there are 5 simple things that research shows can reduce your carbon footprint. And these are the 5 things: waste less food, prepare your own meals at home, eat less meat, dairy and eggs, and avoid greenhouse grown veggies. And I said that, yeah, good news is that it's quite easy to eat more sustainably. But then I would say, and I would ask, are these actually simple and easy behaviors? Probably not. And oftentimes when we talk about behavior and behavior change, there's sort of words that sort of sneak into the language that sort of hint at the more simplistic understanding of behavior. So 2 words we've just seen is simple and easy, something simple and easy. Only oftentimes you see, if only you use this strategy, if only you do this, if only you knew that, then you would be doing that. As also sometimes indicates sort of a very limited model. Good, sometimes we tend to moralize behavior, where a good habit or something is a good behavior, or we were being good because we did this, that, and the other. So that sometimes can be counterproductive as well, these moralizations of behavior. And then the flip side is obviously using words like bad. And a term that you come across oftentimes is this lifestyle, which just sort of indicates perfect control, and we style and bring about our life, and all is within our control, and we're the masters of our own fate. And there's not all these other different factors that some of which might be outside of our control. So the lifestyle is sometimes also indicative of sort of simplistic notion of behavior, or a less rounded picture of it, let's say. So, but so the point I'm trying to make is that people have intuitive models of behavior, and oftentimes they're incomplete because they don't encompass all the different factors that we know are related to behavior. What does that matter? Why would we bother? That's okay. So yes and no. So in a way, it's okay. Not everyone needs to have a totally complete understanding of what are the factors that influence behavior, but sort of oftentimes that translates into how we try and support people changing behavior. And oftentimes, if you think knowledge is the problem, then you try and provide people with education, right? So you have these common approaches to health behavior change where you need to, which is oftentimes sort of deficit oriented. So these people are lacking this knowledge and they don't have it. So I have the knowledge, oftentimes based on my personal experience, and now I'm imparting it on them, and then they know it as well, and then they will go and change their behavior. And so as a result of approaching behavior change that way with this somewhat more intuitive mental models that are incomplete, we use strategies that might not always be the most effective, right? So we might look at raising knowledge, which to some people, if they're the recipient of people trying to lecture them, feels like someone's being a smart donkey. So did you know that? And then whatever information there is that they give you that oftentimes people are already well aware of. Providing advice, why don't you do this? Why don't you do that? So, which feels like being instructed or, shouted at by a drill sergeant, or, motivating and scaring. So if you don't do that, then, bad things will happen to your health. And sort of these strategies are being used, can in some contexts increase the likelihood of behavior change, but might not be the best strategies in and of themselves. So there might be other things that are useful to try and support people to change their behavior, and not just these things. And then oftentimes when people are trying to use these strategies and there is a lack of change as a result, then you have sort of these stable external explanations, sort of, people are just dumb, there's knowledge, it's clear as day, there's evidence, and they're just dumb, they don't get it. Or they're lazy, I've told them what to do and they're not doing it, must be lazy. Or, I've told them how bad the consequences are and they're just, ignorant, they're living in denial. And that can sometimes be a little bit frustrating, both on the part of the person who would like to change their behavior, but is at the receiving end of these strategies, and of the person who just really tries to do well because you want to help someone and you want to improve their health and wellness, but they're just not responding to your helpful suggestions, which they don't seem to realize how helpful they are. Okay, so I've been talking a little bit about strategies and tools that people use to try and change behavior. And I try to make the argument that we're sort of we're using a limited amount that might not be the most effective. So here's a taxonomy that colleagues have put, and I was involved in this one, have put together, where all the different things that we can use and all the different strategies that people can use in order to support behavior change. And you can see that the three I've talked about are just in this list. We've got 40, so there's 37 other ones that could be used. So there's a lot of tools in the toolbox. So we don't just have, instructing, scaring, and raising knowledge. And this is just one taxonomy of many. There's a variety of different ones out there, some behavior specific, like smoking, alcohol, diet, and physical activity, some condition specific, like obesity, and some sort of application specific. So there's one compendium which is for people who want to self-manage their behavior. So there's a lot of tools in the toolbox, and there's a lot of evidence for when people use these tools, that increases the likelihood of them being successful in changing their behavior. But oftentimes you see services, interventions, programs that do not always make use of all of the tools that we know increase effectiveness. Okay, so in the last bit, I want to talk a little bit about a study we've just done last summer in the lab, where we try to understand, so this is more of an understanding project, we try to understand, what do New Brunswickers think about weight loss? So we did a survey with 1,104 people here in the province, and they were adults, and we recruited them on social media and posters and flyers in the community. And we just wanted to understand, how do they see weight loss, and what is it that they do, and what sort of interventions and programs might they support in order to help people who want to try and lose weight here. For those of you who don't know, the prevalence of people carrying excess weight in New Brunswick is somewhat higher than the Canadian average. So the Canadian average is just under 27%, and it's 35.3% here. So in New Brunswick and the Maritimes, prevalence of elevated weight is a lot higher than the national average, which the national average is already a third of the population. So we had people who participated from all over the province, and we asked them sort of 22 interventions that might support people who want to lose weight. And we ask them if they are in favor or against it, right? And here are many. I'm going to present all of them, but you don't need to read them all. The report is up on the lab webpage. You can go there. But I'm just going to highlight a few. So in the category of taxation, availability, and manufacturing, 81% said were in favor of limiting the amount of fat, sugar, and salt that is added to food and drink by manufacturers. So reformulation. And the least amount of support was for limiting the number of fast food or takeout shops in an area. In the advertising, sponsorship, and packaging, so including health warning labels on packaging for food high in fat, sugar, or salt. There's highest number of people in favor of that. Least amount of people in favor of banning advertisements for food high in fat, sugar, or salt. And then the last category was sort of support services. Most people in favor of making healthier food and drink options cheaper. And the least amount of support, but even considerably higher than many of the other options still, was providing greater access to weight loss medication, right? So we sort of got an idea of what were people in favor of and where might support be not quite as high. And we also asked people, what do you think causes obesity? What are the root causes of obesity? And we asked questions in 4 types of categories: behavior, psychology, physiology, and the environment. And we know that obesity is a multifactorial condition, so all of these factors are important, right? But we said, okay, what do you think are the main factors that cause it? And then you can see that the majority of people had a behavioral model, so they thought behavior was important. Psychology was just after that, and then we had physiological explanations, just under 60%, and then only just over 40% agreed that the environment is an important cause of obesity. And I want to focus on this one. So then we looked at how many people who said and had sort of a mental model of the environmental context and resources being really important in terms of driving our behavior and therefore contributing to people accumulating elevated weight. How many of these actions that we've just looked at do people support who say that the environment is important compared to people who think it's not important, right? And we found that the more you think that the environment is important, the more actions you supported in order to change our environment and provide support for people who want to lose weight in the province. So 18 out of 22 actions were supported on average for people who thought the environment was critical in terms of causing obesity, compared to 13 if you didn't have a model that included the of the condition that included the importance of our food and exercise environment. So again, the way that we think about a behavior-related condition, in this case obesity, impacts on the willingness to support behavior change interventions. And we also had sort of a box at the end of the survey where we asked people, any other comments that you have, please feel free to get in touch and let us know about it. And a lot of people talked about stigma and discrimination. Sort of, here's a quote: "I feel attitudes of people who do not have weight problems are very defeating. It's a type of discrimination by those who judge you and assume you're lazy and eat too much. That is very frustrating." And here's other ones: "Weight biases and stigmas are heavily present in New Brunswick, and that needs to change. And I have been overweight all my life and have encountered a lot of judgment from doctors, GPs, and ER doctors. I think our medical professions need to be more compassionate." So you can see that I try to link that to these limited conceptualization of behavior and not really having a rounded picture of all the factors that can be facilitating as well as impeding people doing certain things. And this limited amount leads to suboptimal change attempts, which then can have unintended consequences, such as feeling biased and discriminated against. Okay, so, and it's important to be aware of that in order to be able to address that in the intervention that we then develop. So that's why understanding and with a view to changing is important. So I'm just going to talk very briefly towards the end, last slide, about a couple of projects that we do and I just have them on a continuum here from understanding to changing. So here's a paper we recently published where we try to look at what are the thoughts that people have when they have this sort of internal conflict between a discretionary snack, so something high in fat, salt, sugar that they want to eat in the moment, and sort of healthy eating sort of goals that they might have, and how do they overcome that, this conflict. And we looked at sort of how they talk to themselves and what are the reasons and rationales you give yourself for eating that snack. The weight loss study, I've just talked about some of the findings. The full report is online, and we've got print copies as well if you want one. We're currently doing the Art of Creation project, which is sort of in between understanding and changing. So we're trying to use art and participatory art-based workshops in order to get people to express what they think about becoming a parent and preparing to become a parent, because we know the window before conception is crucial for the developmental programming and health of the unborn child for decades into the future. So we're trying to use art to raise awareness of the importance of preparation for pregnancy, and also what these kind of things mean to people. And then we'll hopefully have an exhibition of the art that's been created around that topic. And then another study where it's firmly in changing, where we're texting men with obesity to support them to change their behavior to lose weight. And we try and use a variety of different strategies that are embedded within text messages, trying to hit many of these barriers that I talked about in this model of all the factors that influence health. So that's just a couple of projects that we're doing in the lab at the moment. There's many more, of course, but those sort of fit nicely along this sort of from understanding to changing continuum. Okay, almost done. So in summary, behavior matters for our health and for our wellness. Behavior change is not simple and it's not easy, but it's certainly possible, especially if we use evidence-based strategies and techniques. And I try to argue that understanding what sort of influences our behavior is important in order to inform evidence-based interventions that provide the structures to help people implement sustainable change. And yeah, thanks very much to all my collaborators and my lab members, my students in the lab, particularly Pat in Scotland and Deb in Canada. And the projects that I've mentioned have been funded by NHR, NFRF, and NBHRF. Okay, that's it. Thank you.
Thank you so much for that presentation. That was very interesting. I think the great part of research that has a bit easier translatability to humans is that you know exactly what applies to you when you're looking at the data and that topic. So I think it's always super interesting. So we do have a bit of time for questions if anybody has any questions. I'll start recording first, but there's the Q&A option down below or just the chat button.